Associate Director with Cloudnine Group of Hospitals. And in continuation of my previous video where I talked about menstrual cup, today I'll be talking about tampons. So what are tampons? This is how it looks like in a box. So tampons is one of the methods which girls and women can use during their menstrual cycle. Like I already said, initially there was just options of using old cloth or cotton, and then came in sanitary napkins. And now there are so many options available in the market. So I thought it was a good idea to talk about them. At the end of the day, it's your choice which one suits you. So what are tampons? So tampons are these devices. These are bullet-shaped devices, and they're made up of natural fiber like cotton and rayon, and they are inserted in the vagina when the menstruation starts. So like I said, it's available in a very convenient package. This is how the box looks like, and this single box contains 12 tampons. And so the tampons are available in sizes for those with medium flow and those with heavy flow. So this one is for those who have regular periods. So if I just open the box and show it to you, this is how it will look like. And it's available in a plastic covering. So when you open, this is how it looks like. And when I just twist open the plastic wrapper, and this is how it comes out. So it's got a body which is made up of cylinder, and this is the one which is the main absorbent material, and this is made up of this string. So first you have to insert it, you have to clean your hands with soap and water, dry them, and then you have to sit in a comfortable position. So either you can sit on the toilet seat and spread your legs, or you can keep one foot over the toilet seat. So with the left hand you'll separate the lips, and with the right hand you'll insert it into the vagina. So this is the vagina, and this is how the tampon will go inside. So it's very important that you don't face the tampon towards the anterior wall of the vagina. So if this is the anterior is where the urethra is the opening of the urinary bladder. So initially there may be a struggle in inserting the tampon, but what I'm advising you is just direct it towards the back of the vagina. So if you just insert it this way, it's going to be very easy to insert it. And if you directly towards the roof, if you direct it towards the roof, then you will struggle inserting it. It's pretty easy, so over a period of time you get used to inserting it. Now once you put it inside, it's very important that it has to be removed after 8 hours. Even the box mentions that it should not be used longer than 8 hours. If you have a heavy flow, it's your choice, you can change it after 4 to 6 hours, but not longer than 8 hours. Why? Because if it is left inside for longer than 8 hours, then there is a chance that you may develop a bacterial infection, and which may turn into a very severe disease called toxic shock syndrome, which is called TSS. So it's recommended to use a tampon in the vagina not longer than 8 hours. And so if you're sleeping at night and if you sleep for longer than 8 hours, then inserting tampons is not a good option. Then there have been reviews that sometimes leakage has been observed with the use of tampons. So when you're trying using tampons, initially you can use either sanitary napkins or you can use panty liners. But if you feel that there is no leakage with the tampon, then that's good for you. So the experience is going to be different for everyone. So I would suggest use it for yourself and decide whether the single protection works for you, or do you need to use additionally sanitary napkins, or do you need to use a panty liners. So we've talked about the insertion, then we'll talk about the removal. Now suppose the tampon is inside the vagina and it's got a string attached. So the string just hangs outside and it'll stay inside your panty. So for removal, you just have to pull the string and take it out. And vagina is basically a blind organ, so that's how a vagina is. So there is nothing inside. I mean, it's not open, it's not going to go and open in the abdomen. So there is a fear, sometimes I hear that women feel that the tampon is going to get lost inside the vagina, or it's going to go inside the abdomen, which is very unlikely. So it's a blind pouch, maximum it's going to go to the roof of the vagina. When you put your finger inside, try to find the string and just remove it outside. So very simple procedure. And so this is one of the options which is available to you. Try it for yourself, and if there are any further questions, you can ask in the comments. And ultimately what you use is your choice, but I felt it was a very convenient option available in the market. So if you are educating your daughters or your sisters, then you should know about them when they come and ask you these questions. So thank you for watching this.